My name is Carol Durham, Professor of Nursing at the University of North Carolina at Chapel Hill and lead of AACN Scenario Development Subgroup. Together with my colleagues Mary Fay, Susie Cardin-Egren, and Marie Gilbert, we've developed a series of 6 short videos designed to support best practices in simulation-based education. Each set includes 2 contrasting scenarios, one demonstrating a successful interaction and another highlighting opportunities for improvement. These video pairs serve as conversation starters to explore key elements of simulation, pre-briefing, coaching, and debriefing. Our goal is to provide practical tools for faculty as they integrate simulation into the implementation of the AACN essentials and competencies. We are deeply grateful to Laerdal for their collaboration and production of these videos and for their ongoing commitment to nursing education. Special thanks to Mary Fay, who portrayed the coach, and our dedicated student actors. We also want to express gratitude to AACN for their steadfast support in promoting simulation as a vital strategy in competency-based nursing education. We hope these videos will inspire thoughtful dialogue and enhance your simulation practices. These 3 sets of paired simulation videos are intended to spark meaningful dialogue about best practices in simulation-based education. They are not a complete training solution, but rather a supplement to ongoing faculty development. All simulation education should be grounded in the NACSL Healthcare Simulation Standards of Best Practice, which offer evidence-based guidelines for designing, facilitating, and debriefing simulation experiences. Effective simulation facilitation requires a growth mindset, the understanding that all educators, regardless of experience level, are continually learning and developing new skills. These 3 video pairs are focused on pre-briefing, coaching, and debriefing phases of simulation. We encourage faculty to view both videos in a pair before using them in training. One video demonstrates effective or success facilitation strategies, while the other presents an opportunity for improvement. You may choose to begin with a success video to provide a clear model of effective practice, followed by the opportunity video to encourage reflective discussion. It is essential to emphasize that the facilitator in the opportunity video is not a bad teacher. Rather, they represent an educator transitioning into a facilitative role, developing a new skill set, and while clearly demonstrating care for learners while they do that. When discussing this video, frame the dialogue with empathy. Many of us have used similar approaches earlier in our careers. This helps to normalize growth and promote a safe, inclusive training environment. Each video set includes a script and teaching points document. Use these as foundational tools, but feel free to adapt the dialogue suggestions to fit your own facilitation style and to highlight key concepts in your own voice. Video set 1, Pre-Briefing. The purpose of pre-briefing is to establish space for psychological safety and orient learners to the simulation experience. While psychological safety cannot be given, facilitators can create the conditions for it by building rapport with learners, being mindful of body language and tone to set a positive learning environment, providing a clear orientation to the simulation space, equipment, and expectations, including the type of modality, for example, standardized patients versus mannequins. Framing mistakes as natural parts of the learning process and as opportunities to grow. Explaining and modeling the basic assumption from the Center for Medical Simulation, which states, "We believe that everyone participating in this simulation is intelligent, capable, cares about doing their best, and wants to improve." Video set 2, Coaching. This video pair demonstrates how facilitators can support learners during the simulation and beyond. In the video discussion, compare and contrast how each facilitator balances feedback by recognizing strengths and areas for improvement, uses a neutral tone to encourage open discussion, makes their clinical reasoning explicit rather than relying on learners to guess what the facilitator is thinking, engages the group in discussions creating a collaborative and supportive learning environment as well. Video set 3 is debriefing. Debriefing is where much of the learning solidifies. It's important to revisit the basic assumption and validate learners' experiences. Allow space for learner-driven topics to emerge, especially those that feel most urgent or relevant to them. Avoid talking too much. Encourage reflection on thought processes, not just actions, providing feedback on positive performance as seen in the video, as well as areas for improvement. Facilitate discussions that link insights from the simulation to the future clinical practice. Always conclude with gratitude and appreciation for learners' engagement, reinforcing the importance of their role in improving patient safety and care quality. Use these videos and discussion points to cultivate a reflective, inclusive faculty development experience. All educators, novice or experienced, benefit from ongoing feedback and support as they refine their simulation facilitation skills. Our goal is to foster curiosity, humility, and excellence in simulation-based education.